I'm Dr. Rosalyn George of Wilmington Dermatology Center, and today we're discussing CoolSculpting, one of our favorite treatments to get rid of that stubborn diet and exercise-resistant fat. CoolSculpting was FDA approved in 2010, and we were one of the first in the country to add it to our practice. We're really excited about this because people didn't have a way to really treat the diet and exercise-resistant fat without going under the knife. So one of the best things about CoolSculpting is there's no needles, there's no downtime, there's really no surgery involved. And it's really not a weight loss method. So people will come in and they have a lot of weight to lose. And what CoolSculpting is really great for is contouring. It really has evolved over the years. It was when we first got it, you kind of go, okay, well there's a bulge, we're just one size fits all, we're gonna put this applicator there and get that specific bulge. And what we've known over the years is really if you treat all the areas that need to be addressed, you can really get a transformation in somebody's body. So say somebody has a little bit of extra on the love handles, it's not really just right here. You might have a little bit in the front, you might have a little bit in the back, your fat underneath your bra might be causing some of the problem. So treating that whole area can really transform somebody's body. So it's really evolved over the last 4 or 5 years into something that instead of just one little area, you're treating the whole area to get the best results. What we've also found with CoolSculpting is that really 2 treatments is sometimes better than 1. So each treatment, you're losing about 25% of the fat. And so when you do 2, you're gonna get better results. So how CoolSculpting works is you come in, we place a gel pad on the area to be treated, and there's a vacuum that sucks up the treatment area into these cooling pads, and there's a controlled cooling that goes on. So your fat cells actually die off before your skin cells die off. So by controlling the cooling over a period of time, those fat cells are actually killed. Once they're dead, it takes about 2 to 3 months for your body to clear those fat cells. So basically, your fat cells are a fixed number, and why people gain weight is that those fat cells actually, if you eat something with a lot of fat in it, or if you're eating sugar, which then gets turned into fat, the fat cells gobble up all that fat and the fat cells actually expand. So you're not getting new fat cells over time. Your fat cells are actually fixed by adolescence. They're just gaining fat inside the fat cells, and that's why you get these bulges. Yeah. The best thing about CoolSculpting is it's permanent. So whatever we kill off, we kill off. Now certainly if you went out and ate a bunch of food and gained weight, the remaining fat cells could expand. But in general, most people try to live a healthier lifestyle after they've had CoolSculpting. It depends on what your goals are for how many treatments you'll need. A lot of people who are just looking to get that last little bit of diet and exercise resistant fat might only need 1 treatment. There are some people that have a little bit more to lose, and so those people might benefit from 2 treatments. The best candidates for CoolSculpting are those people that just have small bulges. So not somebody that needs to lose 50 pounds, but somebody who is in relatively good health, good shape, and just has that last little bit of diet and exercise fat. Right now, we treat mostly abdomen and flanks. It's also FDA approved for the thighs. And luckily, they're introducing new applicators where we're going to have a host of other options that we can treat, different areas, different size. And the best thing is that the treatment time is going to be greatly reduced, and the area that we're treating is going to be larger as well. So this summer, CoolSculpting is launching new applicators. And right now, the treatment times are about an hour per area. The best part about these new applicators are that the treatment time is going to be reduced to 35 minutes. So saves people a lot of time. You can get more done in one day versus having to come back for multiple days. Also, the area that we're treating within the applicator is this little cup that sucks the fat in. Well, right now they're these little small areas that they're treating. Now the whole area is going to be an area that's being frozen. So you're really treating a lot more fat in the same session with less time. So I think the results are going to be really a lot better with these new applicators. The other great thing about the new applicators, we're going to be able to treat places that we haven't been able to treat before. One place that women that come in a lot, backs of arms, sides of thighs, inner thighs, areas that I just haven't been impressed with the results up until now. And so I'm really excited to offer these new applicators because I think the results are going to be a lot better. There is absolutely no downtime with CoolSculpting. Once the vacuum assisted cup is placed to the skin, you feel a little bit of pinching and burning. Most patients will take a nap, check email, read a magazine or a book while they're having the treatment done. After the treatment, you feel a little bit numb, kind of like your foot fell asleep and it's coming back to life. And a very small percentage of people, you'll get a little bit of post discomfort about a week out as the fat cells start to die and the nerves start to come back to life. But other than that, it's a really, really comfortable procedure and people tolerate it back to normal life the same day. Yeah. One question that I get a lot from patients is where does the fat go? So basically what happens is the fat cells are frozen, they crystallize, and they die off. And once they're dead, you have part of your immune system called macrophages come and basically eat them up, and they're just naturally processed through your lymphatic system, and you excrete them in your normal waste. It's a very safe procedure. There's never have been any lab abnormalities or side effects from that procedure. Really, we're just killing fat that we don't need. But with this, you can do it year-round, and some people will see results as early as 4 weeks, but I tell most patients it'll take 2 to 3 months to see the full results. CoolSculpting is effective whether you change anything in your life. So because we're actually physically destroying fat cells versus some of the other devices disrupt the fat cells. So they break open the fat cells and some of the fat leaves, but those fat cells aren't dead, so they can regenerate, and people will see kind of temporary results, and then the next year all of their fat is back. That is not the case with CoolSculpting, and it's one of the reasons why I liked this device the best, and it continues to be one of the top devices with the top ratings because it actually works.